Imagine a scenario where your health insurance suddenly stops working when you need it most, during a medical emergency. That's exactly what's unfolding in India, where hospitals are sounding alarms over a growing rift with Star Health Insurance. The Association of Healthcare Providers of India, AHPI, has publicly accused the insurer of denying cashless treatment to patients at major hospitals, a move that's left families scrambling for funds at the worst possible time. But here's where it gets controversial. Star Health claims it's not to blame, and the dispute has sparked a heated debate about who holds the real power in India's health insurance ecosystem. Let's break it down. AHPI, which represents some of the country's largest and most reputable hospitals, has demanded that Star Health immediately restore cashless services and fast-track partnerships with new healthcare facilities. The association argues that this isn't just about convenience. It's about ensuring patients receive timely care without the added stress of financial strain. But the problem runs deeper. Hospitals report that patients are arriving at emergency rooms only to be told their insurance no longer covers cashless treatment, a promise they believe they'd paid for. And this is the part most people miss. Star Health isn't just cutting off existing partnerships, it's also blocking new hospitals from joining its network. This double whammy is creating a crisis of access, particularly in regions already struggling with limited medical infrastructure. The General Insurance Council, GIC, has tried to mediate, urging AHPI to drop its threats and return to negotiations. But AHPI isn't backing down. In a joint statement with the Indian Medical Association's Hospital Board, the group emphasized that patients deserve more than broken promises. Health insurance is a lifeline, not a luxury, they wrote. When insurers deny coverage after collecting premiums, they're not just harming hospitals. They're punishing vulnerable families at their most desperate hour. Star Health, however, pushes back. The insurer insists there are no reports of cashless services being suspended and accuses AHPI of spreading misinformation. Our customers' access to care remains intact, a spokesperson said, adding that claims will be processed even if hospitals refuse treatment. But critics argue this misses the point. The real issue isn't about claims, but about the availability of care. When hospitals can't afford to treat patients up front due to unpaid insurance reimbursements, the burden falls squarely on the patient. And here's the elephant in the room. The cost of healthcare is skyrocketing, but insurance payouts haven't kept pace. Hospitals cite rising expenses for medical supplies, equipment, and staff salaries. Yet insurers refuse to adjust rates to match inflation. This mismatch has left providers in a financial bind, often forced to reject claims or reduce reimbursements, moves that leave patients stuck with unexpected bills. So, who's right? Should insurers have the final say over which hospitals patients can access? Or does this dispute reveal a systemic failure in how health insurance is structured in India? We'd love to hear your take. Drop a comment below. Does cashless care need a complete overhaul? Or is this just a temporary clash of priorities?